Monday, Trump and Robert Kennedy Jr. made headlines for a very different reason, suggesting a link between autism and acetaminophen, the active ingredient in Tylenol. The president warned parents strongly, do not take Tylenol, do not give it to your children. But the medical community says the science does not support that claim. Yesterday, we spoke with Dr. Pao Coley, adjunct professor at St. Johns Hopkins and Duke University, to break down what we know and what we don't about Tylenol, vaccines, and autism.
Because what we've known for some time, that Tylenol, which is also acetaminophen, that's the generic name, does have a link with autism spectrum disorders. And that's what I call a correlation or an association. Now, notice I'm not saying causation, which means we don't have science that proves that it causes autism spectrum disorders. So could the Tylenol just be a marker of risk, a marker of something else like infection or fever or migraine that's actually causing the risk? And the Tylenol itself is not causing the risk. That's called confounding, because we know for a fact that science has proven no causal link between vaccines and autism spectrum disorders. We know for a fact that these vaccine schedules, which have been around for decades, have eradicated diseases like polio and until earlier this year, measles. So I feel like ignoring the vaccine schedules is poking the bear.
Dr. Coley said she still recommends Tylenol use for severe pain during pregnancy, but cautions moderation is the key. I asked her, if you were pregnant tomorrow, all the science she knows, every study she has read and could recite to you because her brain is bigger than ours. No disrespect. She said, I would take it tomorrow, and I would tell my family members to take it as well for pain.
Yeah, and I didn't go to medical school, and I readily admit that. So I turned to medical professionals for my advice about what to take and what not.
Best TV doctor in America. I've said it here, and I'll say it again.
All right, we do want to hear from all sides on Connecting America. Joining us is Jacqueline Capriotti, CEO of Health Revolution USA and a proud MAHA mom. She also served as former National Director of Chronic Illness Outreach for RFK's, Robert Kennedy's campaign. Thanks for being here this morning, Jacqueline. We really appreciate it. What's your reaction to what President Trump and RFK Jr. said about linking Tylenol to autism and don't take it?
Well, first, thank you for having me on. And so what I would say is, well, it's been a while since I've been pregnant, but my kids are in their mid and late 20s. But I do remember that I did avoid caffeine. I avoided nitrates. I avoided sushi. Even retinol products that were over the counter for skincare, because there were some potential risks that weren't fully defined. There was a correlation, not a full causation that was completely spelled out with those products at that time. So because there was a potential maybe, I decided to not take that maybe, take that risk of a maybe, and just avoided it at that point.
Yeah,
So,
yeah, and sorry to interrupt, Jacqueline, but you're jogging my memory of reminding me of when I was pregnant. You forgot soft cheeses. I remember that there was a moment where I was like, "What can I have? Broth?" That there were so many things that posed a potential danger. The difference, I would say, with Tylenol is that it treats the fever, and what we were learning from our doctor is that doctors don't know if it's the Tylenol that is the link, the acetaminophen, or the underlying fever that is the link to birth defects. So all of the other things that you and I were avoiding were not medicinal. So it's complicated and also sometimes women are in pain and have a fever. So it's complicated to cut out the Tylenol. Your reaction to that?
And I agree with that, and I understand that, and that's why it's not it's a suggestion at this time. And they did indicate that they're planning on doing some intense research going forward. I mean, I think we should take a pause and admit that our FAERS and VAERS system, that is the tracking system of side effects on drugs and on our vaccines, are an abysmal mess. I mean, the CDC itself for over a decade or even more has said that that is what we do rely on for our side effect tracking, but it's not a good system. So we really do have to build up that system in order to be able to really understand how things are affecting post approval, even for OTCs. And now there's a lot of over the counter medications that are recommended that that there are just because something is over the counter doesn't make it automatically safe. Even something that is natural doesn't make it automatically safe. So I think that those are words that we've gotten so accustomed to being that, okay, because it's on the shelf at our local drugstore, we don't have to worry about it. But there are indications that we have to look at. We have to have conversations with our doctors. And I think at the end of the day, that is what's most important, is having a full conversation with our doctors and making that decision with them.
Yeah, I'm glad you bring that up because I read a lot. I watch TV all day long. It's my job. I haven't heard a single doctor or medical association come out and support what the president or RFK are suggesting. Do you tend to agree with medical professionals and associations who went to medical school or elected officials?
Well, I have two children with cystic fibrosis, two adult children with cystic fibrosis. That is a life-threatening genetic disease. And every single decision that we make, we have to consult our doctors or the medical community. I mean, every single decision, including over the counter. And I look to certain people who are in the position at HHS, like Dr. Marty McCary. He is a physician who is an expert in gastroenterology, in solid organ transplants. He actually is one of the experts that has performed the transplant that my son had, which is a total pancreatectomy with an auto islet cell transplant. I think if anybody knows and understands what liver toxicity and how these medications could possibly potentially impact the body, would be him. So I do look at him for some guidance. I've looked at him actually for over a decade for guidance for my own children because of his background, since it's so closely connected to my kids. And there are scientists and doctors over at HHS. So, but at the same time, I do look to the full community, the medical community, who have actually failed my children and also championed my children. There are miracles in science that have given my kids decades and an incredible, better quality of life than they have. But then there are so many failures also that have happened too. At the end of the day, I think we have to just be a little humble and admit that, be it that it's an expert or a doctor or a layman, that we are all humans and we do have to find systems and have open conversations and not be afraid to talk about all of this like we are right now. So thank you for that.
Jacqueline, you said, this is a suggestion not to use Tylenol, but we definitely heard the President of the United States saying specifically, do not do it. Do not take Tylenol if you are pregnant. And the FDA's own website, though, points out a causal relationship has not been established and there are contrary studies in scientific literature. So doesn't this sow a lot of confusion for families about what the right thing to do is when you have a president who's not a medical professional telling you don't do something, and yet there's no scientific evidence that actually says Tylenol causes autism?
Well, I think he may have said that, but I did listen to what he said. They did say, if you can avoid it, don't take it, which sounds to me as a suggestion. But I will say this. I if I was pregnant and there was a chance that this could cause harm to my child, I'd rather know now that there is a potential chance, even if it's wrong, even if they pull it back, just to be able to have that potential knowledge to be able to spark that conversation with my doctor instead of finding out 3 years from now or 5 years from now or even 10 years from now that finally the science came out that it did potentially cause harm to my child that I could not reverse. That would be devastating to me. So to me, I'd rather have that suggestion up front and then work that through with my doctor and go
Mhm.
from there.
Jacqueline
Yeah.
Capriotti. We appreciate you coming on the program and discussing this. Jim, let me just make one personal
Jacqueline, I just want to say,
observation.
Jacqueline, I just wanted to tell Jacqueline, we really do appreciate you sharing your
Yeah.
personal story also and
Yeah.
having the conversation. Because, guys, I think that for a long time you can't have this conversation on national TV because it's so scary. You only want to follow the science. And Jacqueline is saying, like, moms have been talking about this stuff for a long time. So I appreciate you bringing it to us and being willing to have the conversation, Jacqueline. Thank you.
Sure. Thank you.